All right, let's now go across to Mr. Balram Bhargava. He's DG of the ICMR addressing a press conference right now. Listen.
The first one was given on the 9th of March, and the second one has been given on the 16th of March and finalized today. So we will be talking about that testing protocol, and then we will talk a little bit about guidelines for private sector laboratories and what is the status of our labs that we have at the moment in the country. So I think I would just say that the current testing strategy is that all asymptomatic patients who have undertaken international travel should be quarantined, home quarantined for 14 days. They should be tested, that's the first point, tested only if they become symptomatic with fever, cough, or difficulty in breathing. If test is positive, they should be isolated and treated as per standard protocol. So this is the first group, all asymptomatic patients who have undertaken international travel
in past 14 days.
In past 14 days. They should stay at home for 14 days and they should be tested only if they become symptomatic with fever, cough, difficulty in breathing. The second is all contacts of laboratory confirmed positive cases. They should stay at home quarantined for 14 days. They should be tested immediately if they become symptomatic with fever, cough, or difficulty in breathing. Third is the healthcare workers managing respiratory distress, severe acute respiratory illness should be tested when they are symptomatic. So this advisory has got three: all asymptomatic people who have undertaken international travel if they become symptomatic, all contacts of laboratory confirmed positive cases if they become symptomatic, and third is healthcare workers managing respiratory distress, severe acute respiratory illness should be tested only if they become symptomatic. This is in terms of the current testing scenario guidelines, and the guidelines for we are also now, I'll give you the status of where we have in terms of labs, and it may be wise to have more time for questions than me talking. The government is currently, the laboratory expansion of ICMR is engaged. We are expanding our number of laboratories, and as we speak today, we have 72 functional laboratories in the ICMR system. This is ICMR, Ministry of Health system. We have also engaged non-ICMR, Ministry of Health, government laboratories include CSIR, DRDO, DBT, government medical colleges, and we have 49 of those labs which will start testing by the end of this week. I think that's 22nd or 23rd. Would you like to commit on a date?
I would not like to commit on the date.
By the end of this week, 50 more labs, approximately 50 more labs in the non-ICMR system, which are government laboratories, in the DBT system, DRDO system will be activated. So 72 plus 49 will be active by the end of this week. Now, we are also operationalizing, the ICMR is also engaging with high quality private laboratories that include NABL accredited laboratories to understand the modalities to increase access to the test while ensuring appropriate safeguards. And I can talk about what are the guidelines for private sector laboratories intending to test. Here I want to emphasize also two more points, that we are also operationalizing through two high throughput systems, which are the rapid testing laboratories. Two of them, we have already got the systems, we are getting the reagents to start them, and they will be operationalized in 2 locations and they can test up to 1400 samples per day in those labs, and we are operationalizing them by the end of this week.
So the locations?
You can note your point and we'll answer all of them later. Yeah, please let me have. So, in terms of the stockpile of reagents, we have already placed orders for 1 million probes. Reagents and primers are unlimited. Reagent primers are unlimited in the country because they are here, but probes, we have placed an order for 1 million and we should have them very soon. We have also requested the WHO to provide us 1 million probes. So the following have happened: 72 labs, ICMR system, 49 labs, CSIR, DBT, DRDO, government medical colleges. Third, high throughput systems, 2 of them, 1400 samples per day, to be activated by the end of this week in 2 sites. And we are requesting to get more of those high throughput systems, but that may take time. High quality private labs, we are engaging and trying to encourage them to do as soon as possible to help us out, although the numbers of those labs are not huge. They are limited labs in terms of PCR machines, but we are in the process of trying to get them on board as soon as possible. Advisories for testing I've already told about. They are being updated. The first one was on the 9th of March. The second is on today, that is 17th of March. And in terms of, do we talk about anything else you would like to talk about? No, or we open to questions? Now we open to questions. Yeah, I think that is better because that is more informal. Yeah.
I will request one by one. Please ask one by one.
One by one.
Sir,
You can introduce yourself and ask one question.
yes, sir. Levi, I'm Priyank from Times Now. There are few set of questions, although there are 10.
One at a time.
Yeah.
Only one question per person, and then we repeat it.
So the private labs have raised question that who will collect the samples and what tests are approved as of now, and rapid tests of both antibody and antigen agents based are now available. When will they be available in India? So basically the private labs are asking that who should be available, whose sample can be taken and where the samples can be collected, and what should be the process?
Sure. Dr. Nivedita.
So first of all, when you talk of the antibody-based test, what happened? So when you talk of the antibody-based test or other commercial assays, ICMR, National Institute of Virology, is in the process of validating these assays. Today morning only we had a call with them and we asked them about what is the scenario of validating the antibody-based tests. So the people who claim that they have antibody-based tests have yet not been able to deliver those kits for validation at NIV. We are expecting the first lot, that is 2 to 3 kits, to be delivered by Friday. That's what we understood.